Thank you for very warm introductions. The introductions can keep going on the chat box. Welcome to systematic review workshop. This is a beginner's course, and we're hoping to take us through the basic and necessary steps that we need in mastering systematic reviews. We have 5 modules for this course, and each of them will be taken by experts in evidence synthesis, specifically systematic reviews. They are well published in the areas of systematic reviews, and I've taught the course for many years. It's a practical workshop, and aside from the lectures, you'll be exposed to group practical activities like we had informed you, and you'll also be expected to do individual formative assessment. This individual formative assessment will be peer-reviewed, and we've shared the instructions for this already with you. You will receive the formative assessment today, or let's say every Wednesday, immediately after during the group practical activities. So we're very much open to your suggestions on how we can make this a very enriching experience. We are open to giving more clarifications. You can write us an email or send us a message through the WhatsApp chat or privately. We're happy to sort out any issues that you may have. So today is the first session, and I'm fortunate I'll be a moderator for today. The facilitator for today is Professor Ejaz Ahmed Khan. He'll be taking us through introduction to the systematic review itself, the different stages in the systematic reviews. He'll be introducing us to them. So about our facilitator, Professor Ejaz Ahmed Khan is a medical doctor and public health academician with 23 years of experience in teaching, training, and research in public health. He has worked as an instructor, assistant professor, shared professor, and currently a professor at the Health Service Academy, teaching the Master of Science in Public Health course in Pakistan. For 2 consecutive years, 2022 and 2023, he has been ranked among the top 100 scientists in the world in his professional disciplines for Asia. And he has several certifications and short courses, and has served as an editor for national and international journals, and has served as a reviewer for various scientific journals. So Prof. Khan is also a member of our scientific committee, the Systematic Reviews Network. So at this point, I would call on Prof. Khan. I'll call on Prof. Khan to take on the floor. Thank you very much.
Yeah, thank you very much, Fortune. Am I audible to all of you? Anyone can speak out.
Yes,
Or
sir.
just write in chat. Yeah, that's great. That's great. People are awake, huh? That's wonderful. So I was looking at your profiles and what you were writing in the chat, so I could understand that you have some medical student. That's the wonderful things. A few are doing their PhDs. Most of you are nurses, primary healthcare physician, and working at different levels. And midwifery and women health specialists. I beautified Makari just now. That's wonderful. So we have the galaxy of future leaders with us. And today, what I'm going to do is just going to introduce you to a topic which I believe most of you are already aware of, because you are in the profession in which you're also studying along. Most of you are doing your PhDs, or one way or other you are involved in the research or in the projects. So you come across this evidence synthesis day after and every day, or not every day, but after some time you look at the guidelines and for instance, how to do the prevention thing. Somebody is working in one of my favorite areas of environmental health and infectious disease epidemiology. So, and someone is interested in non-communicable diseases. So among you would be someone who is not from medical profession background. So I'll keep it very much non-jargon kind of thing. But my apologies beforehand, because there will be some terminologies for which we have to go through like this. But yeah, so more or less in all professions, when we look at the evidence, we use similar techniques, a bit different, but not much different. So systematic review process, when you go for systematic review submissions, or when you decide that, okay, fine, we have to write a systematic review on some topic. So you need a team. And that team is encouraged to be of multidisciplinary. And I can see 63 or 60 of you, 3 of us are also here. So around 60 of you, a good mix of different expertise and professions. So I see coming up with very good small teams who will be working on their systematic reviews once you finish this course. And along with the leadership of SRN, most of you, I'll encourage, should be interested in writing systematic review with them, so that one is that whatever you have learned, you start putting it in practice, and also you do this very important work of providing evidence for whatever field you choose. So I'll try to keep it interactive, and I expect that you also talk to me and just not listen. And the other thing is this, that what I see, it's not like this, that I'm sitting on this side and I'm only here to teach. I'm here to learn as well. So your experiences, in your field of area and the work that you've done, so we'll be learning from one and each other. You're on that side and I'm there on this side. So it's adult learning. It's not like classroom kind of thing. So you will also be sharing your experiences, knowledge, and adding up to what I'm talking about. And we'll see that how our combined knowledge builds up, and by the end of the session, we are at the level where we are able to look at a systematic review or an umbrella review, or maybe a scoping review or something, but we are well kind of acquainted with the knowledge, but we could look at a publication critically and do a critique on it. And the critique means that you tell the good things and you tell how to improve it. It's not like, oh, you are bad and this is written very badly, nothing like that. So what is the best has been done in an article of a systematic review, and what could be improved in it? And because there is no kind of thing, nobody is perfect. So it's not a perfect world. You will find, because why we do the systematic reviews, we try to generate the evidence which is free of biases. And but the bias is always there. So you try to minimize it. So you cannot remove it, but you try to minimize it. And these all techniques are there to minimize the bias, starting from the randomized controlled trials where we randomize to minimize our bias of selection and other biases as well. And then even in the randomized controlled trials, we introduce some kind of bias, which we try to understand in systematic reviews. And in the systematic reviews, doing the systematic reviews, we sometimes introduce the bias, which we try to overcome through the umbrella review or the overviews of the systematic review. So you see, this is the never-ending story, and you have superior kind of study designs from one over the other, so that we keep on bringing in best and best kind of evidence that we could find. So yeah, so let's start with the presentation. I haven't. Somebody said that to zoom it, but I haven't displayed it yet. I'm going to do that. So just having a little bit of chat with you. So now, any questions from your side to start with? Do you have any question before I start? Anyone? Anyone want to talk about something before I start it? Okay. So,
Okay.
yeah, yes, please.
Uh,
Your
okay.
name, please.
I'm Dr. Richard Yusuf Dakato
Yes, Richard.
from Uganda.
Mhm.
I'm very happy to be here in this network and platform, and my mind was open, ready to learn a lot. And welcome, Professor. Uh, we look forward to a lot from him. But I wanted to know mainly about to make reviews in comparison to controlled trials. Maybe Professor will throw more light on that. Uh, which one is better? Which one is more informative? Which one is
I
why
couldn't get your second one. Compared to what?
to co controlled case randomized controlled trials?
Oh, okay. Right.
Yeah.
We'll talk. Okay, fine. So you see the first slide, this your answer is there. If you look here, if you just look here, this is systematic review and this is randomized control trial. So when we look at the evidence of level of evidence, you see the bottom one here,
Your
uh,
screen is not showing. Sorry.
screen is not
Some of
showing.
us
We can't
are
see
not
your
seeing
slide yet,
the
please.
presentation.
Sorry. Okay, sorry. Let me share. I forgot to share. Now is it can you see it?
Okay, yeah, now we can
Yeah,
see.
you see now. You can see now.
Yes.
You see, I was so busy talking to you that I forgot to um just yeah. So I'll just let me go back to what I was talking about. So you see, Richard, this is systematic review, and this one is the randomized control trial. So they both have a different level, and systematic review is a bit on the higher level of the randomized control trial. And these systematic reviews, if we talk about the medical science or public health and the randomized control trials which are done in the clinics or in the community level, which are also known as cluster randomized trials. So those are looked by systematic reviews, or systematic reviews are done to see the quality of the randomized controlled trials. So that's the difference. And if you ask which one is better, which one is the gold standard, so among the studies, where we have at the bottom are the editorials and expert opinions, then we have the case reports, then we have the case control studies, then we have the cohort studies, and then we have the randomized controlled trials. So this pyramid shows that as we move up, the quality of evidence improves. So for randomized controlled trials, they might, because you see along all this path, what we are trying to do, we want to try to minimize the bias, because expert opinion has the highest kind of, the most kind of, like if I just use my, Joel, you want to say something, please?
Yes, thank you. I just want to add a follow-up to the question. When you have
Okay.
a systematic review, and you also have when you have a systematic review, but what you have there, they are not all RCT, and if you compare that with only RCT, can we still say that a systematic review that comprises other study that are not purely RCT is still stronger than RCT?
No, you see, systematic reviews, they combine randomized controlled trial, and we'll discuss, for instance, we have a randomized controlled trial on brain trauma, right? So And those systematic or randomized controlled trials, there are, for instance, there is a drug like tranexamic acid is one of the drugs. And pharmacists among you, they understand that very simple, very cheap drug. So that tranexamic acid randomized controlled trials have been conducted for the last 20 years or 25 years in different countries by different research teams. And they have different results that whether in some population they work, some population they don't work, and they have some issues. They have less patients. Sometimes they have a bigger, more patients or more volunteers. So, and we have over a decade or 2 decades, we have a lot of randomized controlled trials. And if I want, as a surgeon, if I want to, if I'm a neurosurgeon and I want to use the guideline that what should I do, I look at those randomized controlled trials, but I get confused because not of them, all of them give the same results, and most of them they say that they had very few patients and they are not confident that you should be using tranexamic acid or not. And this confusion is actually removed by the systematic review. And somebody comes in and say, okay, fine, I do a systematic review of, I look at all the randomized controlled trial and I try to find out which one has the least bias and which is has the more precise kind of results, and which one has the more confidence in telling its results. So when I combine them, I find out that there is a randomized controlled trial which has been conducted in more than 4 different centers in 4 different countries, and they have around 40,000 of subjects as participants in that trial, and they have used tranexamic acid versus the usual protocol, and they have found there has been a 10% reduction in the death or mortality rate of the population when the tranexamic acid is given within 30 minutes of the injury. So systematic review then find out there is only one trial on which we can have full confidence, and that systematic review is subjected to overview of systematic reviews as well, because there will be other systematic reviews as well, which were looking at the randomized controlled trials. And for instance, 7 or 8 systematic reviews were published in the meantime, in which they looked at all the randomized controlled trials. And the one which did it very beautifully and without any bias and with very sound results then are taken up by the World Health Organization, by the committee which forms the guidelines, and they form the guideline for the medical community that find, and that is published, that you will give tranexamic acid to anybody who is having a brain trauma or head injury within 30 minutes, and you can save 10% of lives because we have the very good high quality of evidence. Is it clear, Joy?
Yes.
Did I answer your question?
Yeah, but I'm still not very well, not well clear about the answer. What I'm trying to say is that when you have a systematic review that combines studies, not only RCT, which you do have occasionally, but can we still judge that as also, being superior to RCT only?
No, it can have other studies as well. So
Okay.
it can have other studies, of course. It's not just about RCTs. You can have systematic reviews which combine cohort studies. You can have a systematic review which looks at the case control studies. You can have systematic review which look at the cross-sectional studies.
Thank you.
So yeah, so it's just the hierarchy of the study design, but systematic review can combine randomized controlled trial. It can combine cohort studies. It all depends what is your objective and what do you want to see. Because you see, when you look at the cohort studies, and you have the cohort studies, for instance, for the last 40, 50 years, that evidence is much stronger than the randomized controlled trial, in fact. So you can do that. Of course, there are systematic reviews which are done in different study designs. But just randomized controlled trial is just one example, but you can do on other study designs as well. So, yeah, Mohima, do you want to say
Excuse me.
something? Yeah, please.
I wanted maybe some clarification from Professor. you said we can combine, the systematic review can combine other studies other than a randomized control trial in one study. I thought they would be, if you are conducting a systematic review, maybe you involve only case control studies in one study, maybe involve case reports on one study, but you don't mix them up. I don't know how
Yeah,
are they
absolutely
interpreted.
right. No, you're right. You're
Yes.
right. That's what I mean. You combine same time of studies. You cannot do this that you have the randomized control trial, you also have the cohort study, you also have the case control study. Then it will make the things not clear. So it's not, because those study designs are different study designs, and to make an inference out of that would be quite tricky. So what they do, they combine the same kind of study. Most of the time, they try to have the same kind of study. You're very right. Thank you. So a systematic, yes, please.
Professor, this is Jen. I'm asking. Thank you, Prof, for the
Yes, Jane.
Thank you for the description that you've given, but still I've not yet gotten the difference between systematic review study and other designs. What makes it different? If you're doing a randomized study, you say you're randomizing the participants and you're using either systematic or
yes.
but what makes
So
it so different for systematic?
yeah, that's what we are going to talk. And if you just bear with me, we'll discuss these, and then
Okay.
I'll come back to
Thank you.
the what is randomized control trial and what is systematic review. So just bear with me, and then you'll understand this. Your question is good, but your answer is
Perfect.
coming in the coming slides. So systematic review, it provides a clear and transparent process. It facilitates efficient integration of information for rational decision making. That's what I was talking about. So you have the guideline, and you can make a rational decision, because it's important. Why it's important? Because it's a matter of, in medical sciences, it's a matter of life and death. Or taking the public health decisions, or in marketing research, it is required that what works in the market. So you don't want to waste your resources. You don't want to put other things on the make any harm to anybody. So you need to have a very high quality of evidence. So coming to Jane's question, that the randomized controlled trials, how they are different from the systematic review, because systematic reviews, randomized controlled trials are a method of doing an experimental study. Because you see, in the pyramid, the other study, like cross-section study, is an observational study. Case control study is an observation study. Cohort study is an observation study. But the randomized controlled trial it carries an experiment in it. You are having two groups or more than two groups. One is the control arm, and the other one is the intervention arm. In the control arm, you are having the usual kind of treatment. But in the intervention arm, you have invented, for instance, you have thought of a new way of treating some disease. So you just introduce it in that, and then you randomize, and there randomize mean that you do the random allocation and you don't know which one has got which one. So it's a blinding kind of thing, or masking kind of thing. So there are some very specific 3 or 4 criteria which are required to do the randomization, so that you don't know, your own bias is minimized, and the attrition bias, and also the bias of the observer is minimized, and the you manage that the patients, they don't know that which one is getting which treatment, so that you can clearly identify that which is there any difference between the control and the treatment arm, and actually does your intervention works or not. Systematic review, and on the other hand, what it doesn't do any experiment by itself. What it does, that it collects, it looks, for instance, I want to, the same example, I want to know whether tranexamic acid works or not. And tranexamic acid has been applied by different scientific groups over 10 or 20 years in different their experimental groups, and they have different kind of results. Some have very good results, some they have shown no results. And I just combine them in my study, I just search for them, and I just by my inclusion and exclusion criteria, I from the literature, the published studies, I get them, and then on certain criteria, I try to understand which one of those randomized controlled trials have been sound one on which I can trust. So systematic review is something which is kind of, you can say that once the randomized controlled trials have been done, someone wants to look and see that all the systematic reviews on one intervention or a couple of similar interventions, how sound they have been, because we have to make a decision. So systematic review then try to find out that whether, of course, try to find out that this one intervention by this trial has been promising, and it recommends its results and discards others' results. And sometimes it happens that when you do a systematic review and you have the randomized controlled trials, but your systematic review and meta-analysis, it shows that whatever has been being done over the 2 decades is of no use, because there is actually no difference between the control arm and the treatment arm across 5, 10, 15, 20 randomized controlled trials, and the claims made by the randomized controlled trial that it works was actually not correct, or it has issues with it. So it doesn't go into the guidelines. So systematic review, whether it is done on randomized controlled trial or cohort studies or case control studies, or it gives a recommendation whether the results are sound or not. Fine. So it demonstrates where the effects of healthcare are consistent and where they do vary, and it shows like this. So and minimizing bias is important, because you see, even in the cross-section studies or in the case control studies, we come across a very common bias, which is the selection bias and the recall bias. And those biases are very hard to remove from your study until and unless you have very stringent kind of criteria. These systematic reviews, when they are done, you can always go back and update them. Look at the published one, and then you can talk to the authors, and then you can do it again with new kind of evidence. You can always go for that. When you do a systematic review, there is a chance that you might end up also with doing a meta-analysis within those studies which you have shortlisted, and you have looked at their quality. Here in the meta-analysis, you can look at the quantity. Quantity means you can quantify whether this treatment has effect or not. Of course, systematic reviews look at the quality of the studies, but meta-analysis look whether it worked or not. It can tell you. So it can give you the precise estimates of the individual studies. So it allows decision-based evidence. Like it's not like that it is some part is there and some part is not there. So it supports the decision based on evidence. So you see, we take a lot of decisions in our daily life, and most of the time we are taking those decisions based on whatever is our personal observation, and personal observation is most of the time is biased, because it's not coming from a huge sample. And I believe most of you are researchers and you understand the concept of sample size. The bigger the sample is,
Sorry.
you have, yes, please.
Yeah, it's still the first slide that is showing.
You want me to go back?
No. I'm just saying it's the first slide, just in case you. Maybe I thought. No. I'm telling you that it's still the first slide. I thought maybe you had moved on to talking about.
No, not yet.
Okay.
No, not yet. Not yet.
Sorry about that.
Yeah, because it's just about this talking about this slide, because it sets the base for the next slide. So now let's try to understand, because it's not just a systematic review, because some of you when you have done your master's, you are in your PhDs, and you must have written your thesis, and you have and for your thesis, you do a literature review, and you do an introduction, and then you do a literature review. A kind of narrative review that most of the students they do in the universities and LMICs from low middle income countries. Master students in the UK, US, Australia, Canada, what they do, they usually have a systematic review done by their supervisors but in our settings, it's rarely that a master student does a systematic review for his or her thesis. So a narrative review and how it is different from the systematic review. Now, why we do a review? That a review is kind of looking at what is available on your topic in the literature. And that literature is coming from different databases like PubMed, Sinhal, PsycInfo, Google Scholar even. So, and there are a number of databases, but they are very specific for different subjects in which you are working. And all of you have the different background, and you have different areas. And for those areas, if you are working, there are very specific databases which you have to access. And sometimes it is accessible, sometimes it is paid. And so the narrative review is just provides a summary of overview of the topic. But systematic review answers a focus review question. We have a question: why this? Why not this? What is the treatment effect? What is the quality of the studies? So something like this. But the narrative review is just about this is just a narration, just talks about the literature, what is available with us at the global level, at the regional level, at the local level. It can have questions, but it is broad, and it's not like, and there won't be any hypothesis that is stated. But for systematic review, it is clearly defined review question using population, intervention, comparison, and outcome. That's also known as PICO as a guide. So hypothesis is stated that there is no treatment effect, for instance. This is null hypothesis, or there is an effect, treatment effect, or there is an effect of intervention, that is the alternate hypothesis. So hypotheses are stated in the systematic review kind of thing. Now you see, systematic review now becomes a very structured kind of thing, and narrative review remains unstructured kind of thing. Here you are putting some conditions. You're restricting using certain words and certain some kind of you can see there are barriers that, okay, fine, these things should be there. There should be some population, there should be some intervention, there should be some comparison, there should be some outcome. So we are moving towards like from a very literary kind of thing to kind of a scientific approach. So authors for the narrative review can be a couple of, even one can do this one. No. I have to remove this one because this one is not correct. There are 2 authors at maximum, and there can be 1 or 2 or something. But here in the systematic review, you have 3 or more authors. Why you need more authors in a systematic review? Anybody would like to answer? Why you need more people in a systematic review? And in a narrative review, it can be just me, or I can ask any one of you to, maybe Fortune, to come with me and I do a narrative review. But I need a third person or more people with me or more authors with me when I do a systematic review. What could be the reason? Anyone? Without Googling it.
Maybe to remove bias.
Sorry? Yeah. To remove the bias that I might have. So how can I introduce bias in it? What do you think?
There are different ways you can introduce bias.
Yes, Laima.
Yeah, some of them is you would want to, if you're not an expert on the topic, you would want to only be picking studies which are favoring your preconception or point of view at times.
Very good. And what else? So you're very much right that I might be having an expertise in that topic, and maybe I have published in that on that topic a lot, and I would, despite of my all minimizing the bias efforts, I might like them. Okay, let my studies be into the systematic review so that I have more citations or kind of thing. So that also happens. So you have 3 or more authors which we do the independently. They look at the study so that the personal and the academic bias and all those different kind of biases are minimized. Very well done. So for narrative review, you don't have a protocol. You just go there and you start writing. But for systematic review, you need to develop a protocol. It's kind of a proposal. You need to prepare a protocol for randomized controlled trials and some cohort studies as well. But for cross-sectional study, you also write a proposal when you are master's thesis, master students. If you are going for a kind of funding agency, then you have to write a proposal. But if you want to just write a narrative review and want to publish it, you don't need a protocol. But for systematic review, you have to write a structured kind of a document which need to be peer reviewed. And most of the time it is first the protocol is published and then you go for the systematic. And there is a benefit for that. The benefit is similar to the randomized controlled trials, because when you design a randomized controlled trial, you also register the trial. Why? Because once it is registered, then nobody else can do the duplication. And that's the benefit, that then your money and your effort is not wasted. If you don't get a protocol registered and published, then somebody else might be having the same idea and they also start working on that, and you both end up in a conflict at the end. So objectives can be defined or not defined in narrative review, but not in like systematic review. You have to have clearly stated objectives. You have the criteria stated before the review is conducted, all the inclusion exclusion criteria, and most of the time this inclusion and exclusion criteria are essential again to, number one, control the confounders and the effect modifiers for instance in a primary study. Because you see, systematic review is a secondary kind of study, and randomized controlled trial is a primary study. Cohort study is a primary study, but systematic review is a secondary kind of study. You're looking at the literature. Here you do a study for quite time. So you also do a very strict inclusion and exclusion criteria so that you have a specific kind of studies in it, and you also restrict certain elements which may distort the results which you are trying to achieve. So, and then for narrative review, you don't have a search strategy. And then they just do it by keywords or snowballing, something like this. They just find one article and then look at the references and go to those articles and then retrieve those ones. But in the systematic review, you have a pre-written, detailed and comprehensive search strategy, and that we look how to do that. So you have that search strategy and you have to write that search strategy. And sometimes, and most of the time in the universities, these are the librarians which do this, and they write it, and sometimes they are very, very long search strategies over several pages, and then they are run into different databases, and every database has its own keywords, its own way of writing those search strategies, and then you retrieve the information that you require. And list of databases, gay literature, and other sources are considered in the systematic reviews, but in narrative review you can do when it's not stated, you can it's exhaustive, and then you can lead to the publication bias. Yes, please.
Yeah, maybe there's some confusion.
Yeah.
We wanted some definition of narrative review. I have not got that clearly. It involves which type of study? A narrative review. This user studies we know, or it means something else?
No. Narrative review is actually, if you see, narrative review is for instance, it's a traditional review. Have you ever done a review? Have you written a review article, or have you read any review article?
I've done studies like case control study. I've been involved in the usual studies which are done in the postgraduate studies, but not in narrative review.
Narrative
Okay,
review,
maybe I don't know what
yeah.
exactly narrative review is there.
Yeah, narrative review actually focuses on describing and interpreting the existing body of knowledge. And rather than statistical analysis, rather than looking at the critically analyzing it, so it just describes what is available in the literature and what is the literature gap in which you want to work. So most of the time,
it describes other studies.
Yes, it just describes. It describes what is present, what is and what has already been done, and it doesn't consider any inclusion and exclusion criteria.
Okay,
It just
that's very clear. Yes.
Yeah, it just gives you a basis so that you can build your study objectives and other things. So it is the other way around. In systematic review,
Non-structured
you
way.
have So in systematic review, you already have those objectives, and you have this you have a systematic way of retrieving information from the literature. It's not like that you are going to bring in each and everything. You have the inclusion and exclusion criteria according to your research question and objectives. So your objectives and research question is predefined. While in the narrative review it just describes whatever is available. It's a huge kind of thing, and you can go up to any limit and just bring in what and most of the time there is no predetermined research question or research study is also or not there, and you can have author's perspective in it. A lot of bias can also come in because the studies that I want, which favors my study topic or what I want to do, I might be retrieving more studies, but not of those which are actually against it, and that leads to the publication bias, because if you consciously or unconsciously take out those studies which have the negative results, and which might not favor your study, you try to avoid them, and that creates a publication bias. But here in systematic reviews, when we do it, we have such strategy, and we try to bring in all the studies which have positive or negative kind of impact on, because we want to very clearly identify unbiasedly whether it is working or it is not working. But in narrative review, there is an element of bias. Already there is an element of bias. So that's why systematic reviews, they minimize the bias, but narrative review, they carry the bias. And then selection criteria can be subjective, or no selection criteria will be there. But here we have a very clear and explicit selection criteria. So there can be variation in evaluation of study, quality of study in narrative review. But here we have the standard checklist of rigorous appraisal of study quality. So it is not like this. We have the risk of bias kind of thing. We have the Prisma statement. All those things are there. There is a systematic way of choosing and assessing the studies. So, but in narrative review, there is no systematic way of doing those things. Relevant information is not very clear, but here we have a very clear and specific one. We have clear summaries of studies based on high quality evidence, quantitative or qualitative synthesis, whatever you do. So if you do a qualitative synthesis, it's kind of doing a systematic review. If you do a quantitative synthesis, it's going to be the meta-analysis part of the systematic review. Conclusions of narrative reviews are sometimes evidence-based, but could be prone to researchers' bias, because you see the influence of researchers' personal kind of beliefs. But here in systematic reviews, we go for the evidence. We don't let our own experience come in. We have to, like, it's very clear. We are blinded to it. So whatever is coming out of the very stringent kind of criteria, and what is the quality of evidence, we don't have anything. Like, I might be an expert, and for instance, in let's say in air quality. But the systematic reviews, and I think that perhaps there is a kind of there is an intervention which works very which I know, and it should be it should be implemented. But the the evidence coming from the systematic review, it tells us no, that is of no effect. So I have to like go by this evidence. Narrative reviews can be done into days and weeks, but systematic review they take some time, because you have to write the protocol, you have to submit the protocol, it has to be peer reviewed, it has to be published. You do a systematic review, and it takes time because you go to the different databases, you retrieve information according to Prisma statement, then those are reviewed by 3 or more authors, and then you start judging them on some quality criteria, and then you start writing. So it takes a bit of time. It can take months to years, and months to years also includes the publication of systematic reviews. So in narrative, you can just go into 2 to 3 databases. For instance, for the gray literature, you can go to Google Scholar, or for medical subject headings, you can go to the PubMed, or you can for the studies on topics related to the nursing, you can go to Sinhal. So and you can go to the Cochrane database, or you can go to other databases which are subjected to social science or other subjects in which people might be working. So, but one such relevant, you have to do all the relevant databases. You have to search in all the relevant databases, and your search strategy need to be tailored to each and every database, because they have a little bit of different words to be used. So it's not like that you just do 2 to 3, because you see, in narrative review, we do the Google Scholar, we do the PubMed, we do maybe one more EM-based, for instance. We do it, and then we say, okay, fine, we have gone through 2 to 3 databases, but we might skip. For instance, if we take like mother and child health. So mother and child health, Cochrane mother and child health databases, if we don't have the access to it, and we don't look at the articles which have gone into that, or there are other databases which have all the mother and child health articles published in it. Another example is this: in Africa and Asia, we have local databases, and in which the local studies are published. And if you don't go to those databases, those small studies can be like overseen, and again the publication bias comes in. So it is, but in a systematic review, we have a structured kind of thing, and we search all the relevant databases. We don't try to leave any one of them, because if you leave any of this database which is very pertinent, which has the articles published regarding the topic, if you just leave it, then the element of publication bias would come in, meaning that the studies which were published in those databases, or sorry, they are deposited deposited in those databases, we have not gone through them. So they have some evidence which we were not able to access, and our inferences or our results of our systematic review would not be accurate, and they will be prone to a bias, which is the publication bias. This is the place where the overview of systematic reviews, they kick in, or umbrella reviews, they kick in. And then they try to find out, okay, fine, the systematic reviews, are they prone to any bias? And they find that, okay, fine, the researchers, when they were doing the systematic reviews, they looked at all the databases except these 1 or 2, for which they have some excuse that they didn't have the money, or they thought that it was not necessary. But the reviewers have found, because and mind it, that these systematic reviews, they don't publish without peer review process, without going through a rigorous peer review process. So it, like every article has to go through. So once it might get through that, if they miss a few databases, a couple of databases, and it get published as well, because the reviewers were not like concerned about this thing, but anybody doing the overview of the systematic review or the umbrella systematic review would find that and identify that this systematic review was subjected to publication bias. And then the systematic review, which was done with a lot of efforts over a year or two, then it is off. Again, somebody has to do it again, and all of the effort is gone to drain because it cannot be cited, or its results cannot be taken up by the guidelines. So that's why this systematic review exercise is so much important. You invest the human resource, you invest yourself, you invest resources, you invest your money, each and everything in it. And if somebody deviates from its protocols or it doesn't do it properly, then all the effort is gone. Despite being published, it can be subjected to no value. So the narrative review provides summary of literature on the topic. It can be like minimal reproducibility can be there, but systematic reviews provide high quality evidence and supports evidence-based practice, detailed and accurate documentation method using Prisma. Meaning results can be reproduced and periodically they are also periodically updated to include new evidence. And now at present, in the coming years, you will see there will be live dashboards in which the new evidence will be added of the systematic reviews, and that will be very periodically updated. Any questions till now?
Yeah, hello.
Sorry, Prof, I was wondering if we could take the questions towards the end of the session.
End of the session? Okay. Right, so they can have this. So we are going to have questions at the end, not in between. Is it so?
Yeah, but is that okay by you, or would you prefer to have them in
No,
between?
sure. Yes, no problem, but that keeps the actually lecture lively. But if you think that I should be finishing and then taking the question, then it's also fine as well.
Oh,
So
okay, I think maybe we can be taking one question in between, sorry.
Okay.
So Owen,
we take
Owen, your hand was raised.
Yes.
Okay, so we take 1 minute break.
Okay.
And because it will get saturated. So we'll take 1 minute break and then I'll come back.
I thought I could ask my question before. Hello?
Yeah. Hello. Prof, can you hear me? Owen, just go ahead with your question.
Yeah, so he talked about the fact that especially for systematic review, there are some journal houses that you can get your publications from. I just wanted to find out, can you just search into only one journal house to use that as a basis for your review? For instance, you just search into Scopus or just Google Scholar and then use that for your review, or you must necessarily search more than one journal house? Thank you.
Okay. Prof, did you get the question?
Fortune, I think Prof said you take 1 minute break and he'll be back just now.
Okay.
In a few seconds, he should be back. Yeah.
Okay. So when if I have to attempt your question, I understand you're asking if you need to search one database, for example, Google Scholar or PubMed, or if you have to search more than one, right?
Yeah. Yes.
It's advisable to search 3 to 5 databases, or let's say as many as you can, but recommendations is between 3 to 5 databases.
Okay.
Yes.
Okay.
And I would
yeah.
go ahead,
Yes,
Prof.
please.
Go ahead.
No, somebody has a question, and you were talking, sorry. Please carry on.
Prof, I think I've attempted the question, so you can go ahead, please.
Okay. So now let's try to understand. You might have a question that there is another thing which is known as scoping review. So scoping review is a close relative of systematic review, but a far relative of narrative review. So it has some of the things of systematic review, like it has a review protocol. Sometimes it has it doesn't have to be registered with the Prospero, which is the Review Protocol Registration Authority. It has to be explicit, transparent, and peer review search strategy, just like systematic review. It has a systematic search of the literature, the scoping review. It has standardized data extraction forms, just like systematic review. It doesn't have mandatory critical appraisal. Risk of bias assessment is only available for the systematic review, and the synthesis of finding from individual studies or the summary of findings is for the for doing this meta-analysis kind of thing is for systematic review. So from narrative reviews, scoping review is a bit better quality of evidence, but still has a lot of problems with it when it comes to the biases, and which are taken care about in the systematic reviews. So why we do all these three? Why don't we do the systematic review only? Everybody doing the systematic review only? Because you see, you need something to generate hypothesis. You need to have some information. And sometimes you don't have the high quality of evidence. You sometimes don't have the, you have very different kind of studies done in the same area as the one question was asked earlier. So for that, you don't do a systematic review, but you can do a scoping review. And that gives an overall picture what is available. And somebody wants to do something unbiased and take it to the next step, can do the systematic reviews. So all these studies are published. All these are done with different, their specific objectives, but the gold standards are, of course, it all depends which level of evidence you want to produce. And if you want to if you don't have very high quality of evidence, high quality of studies done, or many studies are done, or studies with different study designs are done, perhaps you try to do a narrative review or scoping review and don't go for the systematic review in some areas. But in some areas of research, you find many studies which are, there are randomized controlled trials, or there are cohort studies done, or case control studies done, and you want to, and there is enough evidence is available, and you want to do a systematic review, and you want to find that whether it is the quality of evidence it is to at what level, then you can do a systematic review. So this thus gives an overview how the scoping review, the umbrella review, and systematic review, they differ at the level of definition, purpose, research question, methodology, bias control, data sources, and outcome. So these are very important aspects, because for definition, the scoping review, it preliminary maps the existing literature on broad topic to identify gaps and trends. Systematic review is a comprehensive structured review of all the relevant studies on a narrowly defined research question. And the umbrella review, it is something sitting on the top of systematic review, and it reviews the systematic reviews and meta-analysis on a specific topic, summarizing high level of evidence. Now you see, systematic reviews are also subjected to bias. And this umbrella review, or overview of the systematic review, the other name is overview of the systematic review, is to look at systematic reviews on the, for instance, same intervention, and or a set of interventions, or a set of studies of high quality, and which the systematic reviews have assessed. And the umbrella review then discusses all those systematic reviews and see that whether which one works for it. For instance, in there can be, we can take one condition, and that is the injury or trauma in which the bleeding occurs. And there are a number of interventions in it. Some injections are given to release the swelling of the brain. Different liquids are given to improve the blood pressure of the patient, or some other medicines are given to make the survival better. And this is all about the major trauma, for instance. So, and there are systematic reviews on all these 3, 4, 5 conditions. And we have, for instance, 15 systematic reviews. Some of them they are looking, are done on the drugs that release the swelling of the brain. Some are done on the liquids which are given to make the survival better. Umbrella overview, or the overview of the systematic reviews, it looks at all those systematic reviews and find out which one, 2, 3 have been done properly, and which is the highest level of evidence. So umbrella review then will recommend that systematic review, that this has been done properly. It has the highest level of kind of evidence, and rest they have done something, but we are not confident over that. So only one would be taken, or 2 would be taken as per the guidelines. So again, over the systematic review, there is an umbrella review. So there are, and we understand that the purpose is to synthesize finding from multiple systematic reviews, providing an overarching summary of the evidence in the umbrella one. So this is the comparison of these studies. Now you see the pyramid, it had the expert view at the bottom and the systematic review at the above. And now we have another thing above the systematic review is the umbrella review. So that there is another kind of thing which is over there. So all of these 3 studies are reviews, but they have different kind of objectives. So before initiating a systematic review, we have to understand 4 main aspects in managing the review. Number 1 is the formation of a review team. And that's why I say that you are a beautiful galaxy of participants. You have different areas. Some people are pharmacists, some are from the nursing profession, some are the primary healthcare physicians, some are marketing research, some are PhD researchers. So the PhD students doing their research studies. So you have a very diverse kind of team which could co-found or co-design a systematic review. Then you should have an advisory group which should advise you. So, and those can be healthcare professional, patient representative, service user, expert in research methods, lay people even, or if you have the funding, so people from funding agency, they're also sitting there. So that advisory group should be advising and guiding the research team. Then the timeliness of completing various evidence synthesis are important. And because some of the collaboration, they suggest they have some timelines, like 1 year you have to complete it. Then you have to engage the stakeholders so that for the policy and practice in the community, and the biggest stakeholder is the community. Then you have to select software that will be need to consider for various stages of systematic review processes. So what are the software for various processes in a systematic review? When you manage the references from the literature, I would say the most freely used by the students and the researchers are Zotero and Mendeley. So because they're free. If you have a Gmail account, you can have Mendeley downloaded on your desktop and you can enjoy. You can also have the Zotero, it's free. EndNote, Reference Manager, EPPI Review, they're all paid versions. If you can afford, if your university has it, then fine enough. But if you cannot, you can use the free versions. And they work very fine, Mendeley and Zotero, but you have to be careful working with these, because sometimes the glitches are there and you have to be good enough. If the Vancouver style of referencing is required, then do go back and see if they have literally given you the Vancouver style, is not something else. So you have to just inspect it. Random inspection should be there. So there are different organizations which provide them. For screening, we have Covitens, we have EPPI. Rayan is one which is mostly used nowadays. It is free. You can use MS Excel as well, but you need to have the plugins in it. And then Summary is also free by JBI. JBI is one portal which you can visit. They have a lot of things. They have this systematic review registration as well, randomized control trial registration. And they have those softwares developed, but they are partially they also have upgraded versions. So it's free, but with the upgraded version. And then we have the distiller and API value viewer, and these are the paid one. For coding purposes, again, the Summary, MS Excel are available, and then the API reviewer is for paid version. For data extraction, we have this. You can do it by Excel, SRDR, Summary, or Distiller, and these are the organizations which provide them for the researcher. For critical appraiser, again, Kari, Mastari, and Actuary, these are the one, and the Excel one. They are there for the critical appraiser. And Kari is, I think, for the qualitative kind of thing. And rest you can use, like MS Excel, you can use for the quantitative one. For meta-analysis, we have Rabman, which is Cochrane, given by the Cochrane, it is free. Of course, then Stata and SPSS R is free. And then Open Meta-Analyst and Mastari is also, they're also free. So whatever is possible, whatever suits you, whatever you can afford, and which one you are, your team is you can say easy, and they feel happy, they can use that one. Sometimes it happens that if you're doing a commissioned research, they ask you to use the paid versions. They are more confident in that, but then you can always budget them. So these are different databases. Where you have to go and try to find them. So there are different, So you have different databases, like these are the effectiveness reviews is there, and then the Agency of Health Research and Quality is there, Scottish one, BMJ Evidence-Based Medicine is there, Prospero, done in research and practice, and search filters and major databases. So these are the different databases where you can go and find those. So systematic reviews, as we see, they have explicit methods to identify, select, appraise, and synthesize results from similar but separate studies. And the other thing, meta-analysis. This is statistical analysis of a large collection of results from individual studies in an optional component of systematic review. So we'll be doing a group work in groups, and you will see that you will be given a systematic review and meta-analysis article or an umbrella review, and you have to judge it on certain criteria and try to understand it and see whether how they have been done. And you will find these meta-analysis done in those. If the systematic review is there, there will be a component of meta-analysis for quantitative part. So the protocol is like you have to frame research questions. So as I talked earlier, this population, intervention, comparison, and outcome. Then you have to develop a search strategy. After that, you develop a protocol, you run strategy in at least 2 databases for piloting, and then retrieve and deduplicate the citations, develop systems of screening titles, abstract, and full text. Then you screen titles and abstracts, and then retrieve and screen full text. So there is a process of doing all this. So at least 2 to 3 databases are required to run the search strategy, and there could be more. And what we do usually that we try to access as much as possible, which are the most pertinent one. And most of the time, what happens that when you access the databases, for instance, in EM-based, the studies which are you find them in EM-based, they're also found in PubMed, it's also found in Cochrane. So those duplications would be there that need to be removed once you do these Prisma statement kind of thing, which we look in the coming slides. So that's just the definition of PICO. So what you have to give the background. what has already been done and what you want to, which intervention you have to look into. Then your objectives, what you want to do, how would you do that, and how would you search for the identification of the studies. For data collection and analysis, you have to write about how would you extract data and how would you manage it, and how would you assess the risk of bias in including studies, and how would you measure the treatment effect, what would be the unit of analysis, and if there are issues, how would you deal with them, and how would you deal with the missing data, and how would you assess the heterogeneity or the differences between the results of the different studies, which are small and large studies. How would you tackle for them? And then how would you assess the reporting biases, do the data synthesis, risk of bias, quality of evidence, subgroup analysis, sensitivity analysis, references, etc., etc. So these are all the headings actually. So a protocol has these headings, and these are the journal headings. They can differ as well according to what kind of, if it is Prospero or JBI or others. So wherever you are submitting your protocol, you have to follow their guideline. But these are the journal kind of guidelines where these headings and subheadings should be there in your protocol, just like a proposal. So developing the forms for assessing risk of bias and extracting data, then assessing the risk of bias, and cleaning, managing, conducting qualitative synthesis, conducting meta-analysis if required or appropriate. Then you write the report and then update the systematic review. So typically at a given point of time, more than one step is being carried out, and that's why you need a team there. So you divide the work, that somebody is doing managing the data, somebody is doing the qualitative synthesis, in which we'll talk about the grade system, in which you examine and judge a study based on that criteria. So let's look at this is just an example about one study. So problem statement, when you give a problem statement, that what is the problem? Why you want to do this systematic review? For what? So the problem is this, that little is known on the effectiveness of advocacy programs as compared to other treatments on women's quality of life among those who have experienced domestic violence. The review question would be, for women who have experienced domestic violence, how effective are advocacy programs compared to other treatments on improving the quality of life? So this is our review question. Immediately, if you ask such a social science question, you have in your mind that fine, there should have been some advocacy going on, and whether we have to look at what was the effectiveness of advocacy programs as compared to other interventions improving the quality of life for women. So the aim is to evaluate the effectiveness of advocacy program, and our objectives could be such papers on effectiveness of advocacy programs, other treatments, then to collect data on the effectiveness of advocacy programs and other treatments, then to compare the primary studies on different treatments and compare the findings of the review and the different reviews and provide guidelines. So you see, there is a very quantifiable kind of objectives, and that also go with your methodology. So your objectives of a systematic review, they build or guide your methodology as well. So ultimately, we come up with a title. So you see, you never get to the title at the beginning. So a systematic review on effectiveness of advocacy programs as compared to other treatments on improving the quality of life of those women who have experienced domestic violence. So that's our title of our systematic review. So we have a small team. All you people, you are not small, you're almost 72, 73 people there. But that's how we started up. We had a problem in our mind, and then we had an aim, and then we developed objectives, and then we came up with a title. So there are when you're looking for the when you have the research question where you have the title, then obviously you are going to make your search terms, and then you go for the search for the for different studies. But bear in your mind, please, that they have very close meaning kind of things. They have different spellings or acronyms, for instance. The British English and American English, they also have some issues. So you have the leukemia, and there was leukemia with an A in it here. So this is, sorry. I just wanted to take a pen. So you see here. So this A is from British English. So you have to include this as well so that you don't miss the articles which have this A in the leukemia, and they are also included in your search strategies. Then the complex kind of concepts, long-term patient reported satisfaction, surviving breast cancer, for instance, and so on. Then umbrella terms and specific names. Then you have the keywords. Like tumor, cancer can also be known as tumor. Cancer is also known as carcinoma. It's also known as neoplasm, which is a medical subject heading kind of subject heading, which is very typical as a medical jargon. And then you have, there are a number of sources. We have the Google Scholar, and then we have the PubMed, which we also have open gray kind of for the gray literature. And mind it that we need to look at the gray literature because there are a lot of studies which are not published on the special on the established databases. They're also because why it happens, because the researchers in the low middle income countries don't have the money to pay for those high impact journals. So they publish in free of charge journals or small journals which are not indexed as per in PubMed or other databases, but they are there on the Google Scholar. So that's why we do it, so that we don't end up with a publication bias. And then you have the social science research, ssrn.com. This is special research on economics and business management, and it includes databases for forthcoming papers and working papers. And also during the COVID times, we also saw this preprints. So there are huge preprint now available, which is available, and it is not as published, but it is published as a preprint that can also be a good resource. And then we have the ProQuest, which has master, MPhil, PhD thesis databases, and you have your own country's databases, universities databases, in which these masters and PhD theses are there, and they are not published, but you can access them through your university library system. So different databases would need different search fields for conducting a search. For instance, for PubMed, search the text word field for free text terms and match terms for control vocabulary terms. For instance, sunshine, TW, sunlight, TW, the text word, TW text word, and sunbathing, MH, sunstun, MH kind. So these are very typical kind of you can say the attachments with those words which are specific for PubMed. For EMBase, for instance, they have the TI for the free text terms, and M3 terms like term/X for control vocabulary terms like sunshine is TI, AB sunlight, TI, AB sun exposure X. So these are very specific for when you're doing it for EMBase, use same terms that you are using, you have to end up with their required extensions. And for PubMed, you have to end up with their required extension. Now, syntax for PubMed, this comes from the Cochrane Handbook. 1, randomized controlled trial. 2, control clinical trial, randomized, placebo, drug therapy. 1, 2, 3, 4, 5, 6, 7, 9. We combine them with a Boolean, and then you come up with now all this is the kind of search terms which you combine them with Boolean operators, whether you use and or not. And if you have ever done this kind of search on PubMed or other databases, so they combine the terms or broaden its scope or combine it, because you see, when we say number 1 or 2 or 3 or 4 or 5 or 6 or 7 or 8, that means we need all of them. So we want the search engine to look into randomized controlled trial, look into the controlled trial It also have to look into randomized, placebo, drug therapy, randomly trial, and the groups, all of that. But we don't want animals studies in it. So that's number 10 is animal, not humans, for instance. No, sorry, not humans, but we want to look into the animals only. So it's other way around. So it shouldn't, the studies which we retrieve are going to be retrieved from the PubMed. They should not have human subjects as experiment, which only have to have animals, because of course, human subjects are not subjected to the, it's unethical to subject them to experiments. So, and of course, the permission are also required for animals, but most of the trials are first phase 1, phase 2, they are done in the labs as well, and the animals are subjected to the experiment. So that's, and then 11 and 9, not the 10. So we finish with that. We won't have the, we are not going to have the randomized control trials, which include the humans. We're only going to get trials on the animals, according to whatever we want to do on the study, and they will have all these elements in there. So this is the Prisma. Okay, I have. Sorry, I see. Yes. Yes, of course. Systematic reviews can be conducted in other, sorry, that's from, it can be conducted in other fields as well. No issues. It is so. So, so this is the Prisma kind of flow diagram, process of study selection for inclusion in systematic review and meta-analysis. So, for instance, we identify through database search, we have this 12,872 records were found, additional records were identified, and then duplicates were removed. And after the removal of the duplicates, we record the records were screened, and then 9,530 records were excluded based on the inclusion exclusion criteria. And then we had the full text which were available were around 285, and then we included 124 studies in the qualitative synthesis, and 124 were also included into the meta-analysis. So full text articles excluded. Only child, for instance, sexual abuse, no physical, emotional abuse, all those. Why we did it, we just put it there. So that's how, starting from 12,872 studies, we come up to 124 studies only. So this shows the process that we have gone through a systematic way of looking at the literature. We have retrieved the studies based on our criteria that will lead only full text studies. We are not going to take only the abstract only studies. And again, our keywords are very much important. And ultimately, we come up only with 124 studies. Because if you don't have this kind of scheme, you will be analyzing 872 studies, which will be hell of the work. With a proper way of filtration, you get 124 studies which are doable by your team. And also they have the backup of some kind of good criteria. So this is the summary of review findings on health consequences of child non-sexual maltreatment for disorders where data were insufficient to include in the meta-analysis. If you look at, we have this, for instance, allergy, and we have the odds ratio of 1.38 with 95% confidence interval, lower bound 1.06 and upper bound 1.78. So different odds ratios are there. So that the confidence intervals actually means that the broader the confidence interval is, the less reliable or your results are. The narrower the confidence intervals are, you are more confident on the study results. So there are a number of studies, 153 studies, for instance, are on just on the allergy, and anemia on 33 on the studies, and weight are on 33 studies are there. So this analysis shows that our finding how many studies have shown what are those results in different all those areas. And this is another summary result of reported in systematic review of a systematic review of the reviews. And here you can also appreciate that we have the number of, for instance, this was about beta limited compared with the placebo or no treatment. There were 12 trials with an odds ratio of 0.59, about 40% of effect with 0.4 to 0.83 constant interval. And because it is 0.5, it has a significant results. And for birth area and for the 37 weeks. So all of them, they show different systematic reviews done. And then this is an example which is typical for umbrella review. It is from the overview of the systematic reviews, where you see that different systematic reviews have been done, which included 12 trials or 2 trials or 11 trials. And those, again, were assessed by this overview of the systematic review. And ultimately, the inferences have been given in different areas, whether they were significant, the results were significant or non-significant. This is the assessment of the study quality. Now, quality, when we look at the quality of the study, we look at whether the representation of the population was there, ascertainment of exposure was there or not, selection of non-exposed cohort or controls were there or not, child abuse and neglect, which is one of the outcome, was there or not, case definition, assessment of outcome, etc., all of them. So when you look at those studies, you try to find out and you to start tabling those population-based representative, one, not representative, selected group, volunteers with no description, you give it 0. So 1, 0, 1, 0, 1, 0. It gives 1 for yes, 0 for no. So all that quality criteria. So ultimately you combine them and you score them and you give for each and every study you do such an exercise. This is one way. And then you can do the summary of strength of evidence of related health outcomes. So you can say whether it has the limited, weak, inconsistent evidence or limited evidence, so that or whether the robust evidence. So that's how you plot, or you just based on those criteria, based on that quality, you give a table on which you, for each and every condition, you give whether the evidence has been robust, weak, or has the limited, or we have the limited evidence. For instance, we don't have enough studies there which could give any kind of evidence, whether weak or robust. So this is about the systematic reviews that you do, and you do all these kind of their assessment for their quality. So now we have half an hour left with us, and I think we should if we continue, we want we would like to have this small group work with you. And Fortune, what do you want to come in here and so that we could go for
group
yeah,
practical activity.
for the group work? Yeah.
Oh, okay, great. All right, Prof, maybe we're already 36 minutes into the group practical activity. So unfortunately, I would not be taking questions. So I will just create the breakout rooms now, and we can go into our various groups. So just need a minute to do that. All right, so the breakout rooms have been created and you can join your breakout rooms. Kindly note that we will shared with you the document for the group activity, the document you'll be critiquing, and we also shared with you the tool you'll be using for the critique. We also shared with you the name of the breakout room or the group that you belong. So you should join. You have to join the group accordingly. Thank you very much. So we have for 15 minutes for this activity. And our SRN contact person will be joining your team. And if you have any challenge, you could discuss with the person. Thank you. If you're not sure if you're you could.
Please, quick question. How do I join the breakout room? Like, how do I see them and join?
Okay, but you know which group you will belong to, right?
Yes, I do.
Which group?
Kampala.
Okay, so I'm just gonna add you there now, but you should see a button on your the top right part of your screen.
Okay, yeah, I just did.
Okay, great.
Thank you.
All right.
I have not been able to join.
Okay. Can
Please.
you check the top left of your
Top
screen?
left?
Yes.
Yeah, I'm looking at the top left. I can't.
Or maybe are you joining with your system or your phone?
With my system?
With your phone. Okay, with your system. You've not
Yes.
seen it at the bottom as well?
No.
Okay. Let me add you manually. Which team, please? Which group?
Lusaka.
Okay, Osaka. I'm going to do that now. Osaka. Okay, we still have so many persons that have not joined. About 27.
Hello.
Yeah.
Same thing here, Regan Baluko. I'm in Team Lagos. I can see where to join my breakaway team.
Okay. Regan Baluku. I'm going to assign it to Lagos now. I've done that.
I can't also see my.
Okay, please
my
switch
group.
to Tuare. Which group? Which
Ture.
group?
Kigali.
See somebody in the chat box. Kathmandu, Tijani. All right, Tijani, I'm going to assign you to chat Kathmandu now.
Can you also assign Kainos to Kathmandu?
Okay, Kainos to Kathmandu. Yes, I can do that.
And then Agnes to Kigali.
Agnes to Kigali. Yes, I can do that. So Beatrice, Boas, Doreen, Emisamo, Emmanuel Fadipe, Gloria, Jonathan, Lawrence. Please let me know if you are having challenges joining the breakout room. Tidimalo, Shambaj, Sabine. All right, Prof, please, how long should we give for this practical activity, please?
Yeah, I think we should be quick because it's just 15 minutes left. 10 minutes, I think. And if they can have 10 minutes and then we can quickly just a minute or so, a quick feedback from the group lead. So they have to go through it very quickly.
Oh, yes, yes.
So if we have half an hour, then we can give them 15 minutes and then we can discuss. But I think we have only 15 minutes left, perhaps.
All right.
It's up to you.
So, Gloria to Rabat. But kindly know that you can assign yourself to a breakout room. There should be a button, maybe the top left or top right or somewhere in your screen that should prompt you to select a breakout room. Evrat Misalmov, which group, please? Adinka, Beatrice, Boaz, Lawrence, Cyril, Victoria.
It is not systematic review. It is not systematic in review because you see they didn't use the protocol. There is no mention of protocol. They have deviated from the systematic way of doing the literature review as per the definition of the systematic review. So it is a systematic search of the literature. So they have reviewed the literature, but in a systematic way, a bit of systematic way, but not fully. So we cannot say that it's evidence, the evidence coming from this article, which is nearer to the scoping review because of its systematic search, but away from the systematic review because it doesn't follow the protocol and all the necessary gradients of a systematic review. So it is an in-between kind of thing, and it's we can conclude that the evidence coming from this review is because it is not been subjected to there are elements of biases in it. They have not looked at the risk of bias. Only 2 people were doing this systematic review, a systematic literature search. So there is a high chances of introducing the researcher bias in it. So any study which claims to be qualified as an evidence synthesis, it need to be free of the bias at the maximum level. So but their processes have led to the bias in them, we cannot take it as a high quality of evidence. And it also, and of course, they've already stated that it's a systematic literature review. It's not a systematic review. So it is different from systematic review.
Similarly, is there any method to critique such articles like literature reviews? Because we are having like Prisma and ASMA for systematic review, but is there any critique for literature review?
Yes, for literature review, why we do because you see why we do the systematic review is to look at the quality of evidence. A simple literature review, whether it is a narrative review, we don't look for the quality in that one because it just describes, it just helps us generating a hypothesis. It's not the evidence. When you are looking for the evidence, then you have a very strict criteria. So this article especially was put in because it's not a systematic review, just to check whether if you just consider it as a systematic review or not.
Okay, thank you.
You're welcome.
Prof,
So I think we are back into the main room. Yeah, I'll stop sharing and then over to you, Fortune.
All right. Thank you very much, Prof.
Hello, everybody. Hi, Prof. Can you hear me?
Yes.
Okay, great. So please, can we ask 1 or 2 teams to, share their screen and discuss the findings of the article?
Yes, please.
Okay, good. So please,
Let's
could
see
you?
who is brave enough. Let's see who is brave enough. Which group is the bravest one?
Group 6.
Prof, our group is the
Go ahead,
worst. We
please.
didn't participate.
Go ahead, please.
Hello, does someone wants to speak? Okay, so we have Raymond. So Raymond,
Yeah,
you.
sorry, I was just, I was just going to ask, are we not over the time for the session? Unless if I'm getting this wrong, so that if, I need to continue joining or something, is this continuing or I thought we were coming to a close?
Yes, Fortune, we have time.
Yeah,
Isn't it?
Eh,
sorry, I didn't get your question.
No, I
He
was
is
just
asking.
saying, I thought we're coming to the end of the session, and now we are discussing back in plenary.
Yeah, Prof, what do you think? Do we wrap up or do we get a presentation from one team?
I think one or a couple of groups can just quickly present and then we can close off.
Okay, great. So, if you're able to complete the activity, you could share your screen. Great. For the other teams, yes, you can work on it some other day and try to share with us as soon as possible. We'll share it across to Prof and he'll share feedback with you. Thank you. So we have Joel. Go ahead, please.
Yeah, thank you for this opportunity. Can you hear me?
Yes, we
Yes.
can.
Yes,
Okay,
yes,
great.
you are audible.
Okay. In our group, the article that was provided for us is the one on social media use and impact on adolescent mental health, an umbrella review of the evidence. And we look at the criteria in that particular tool, 11 of them, and we try to match it against the content of the article. But unfortunately, most of the answers were no, because it seemed as if the criteria, I'm not sure whether it was designed for this type of article. And that's one of the questions that we came up with, one of the concluding question that looking at it, all the questions that we were asking were no, because they didn't, or except if this particular article was the one that was not properly done, properly conducted. Looking at where we're supposed to get most of the answers to the questions in the methodology section. The methodology section has just only 2 paragraphs, which was scanty, was not detailed enough. So that now led us to most of the questions that we were asking were no, because we didn't see whether there was any protocol that stipulated that a research question and that detail how they will go along with the review. It wasn't stated, and almost all the questions were answered no, except on number 8 and number 9, which we have yes. Number 8 and number 9, the question number 8 asked that was the scientific quality of the included study used appropriately in formulating conclusion. Yes, we answer yes to that, because they stated that in the conclusion that based on the it. And also there was a question that asked whether there was any forest plot. There wasn't any there wasn't any figure, no picture, no diagram that was stated. So all of them were no. Question 9 also, the method used to combine the finding, that we saw that they use some statistical measures. We saw that one in the article, but most other one were no. And also question number 11, they declare that they had no conflict of interest. So of all the questions that were asked, we answer yes to 3 of them, 8, 9, and 11. Other were no, no, no. And as I said earlier, that we're not sure in our group whether the tool
it's actually meant for umbrella review, or the tool is meant for systematic review generally. So if it is for systematic review generally, probably we will have seen some of the questions that we're looking for. But because this is an umbrella review, most of those information that we're looking for were not available in the paper. Thank you. So, Prof, I think we need to help us with the question.
Hello, Prof. You have comments for that team?
Yeah, thank you very much for presenting this and using the tool for this article. So your one was on actually
umbrella
on,
review.
That was on that was overview of the systematic review. So Amster is used to actually look at the systematic reviews, and but you can use it for umbrella review as well if you want to. But most of the time it is used for the systematic review so that you can understand whether they have used the correct way or not. But you have, of course, you have used it on the umbrella review. But mainly it is for the systematic reviews for themselves. Using it for the umbrella review, it can be used, it can be modified, and it can be used. It's not like this. And what you have done actually is, for the practice, it has been quite a good effort. Yeah, I would say that using the same tool for the umbrella review and identifying the areas which were not there. So this is, I think our objective was this, that whether you can use the tool and you can see those things which have been taught today about the systematic reviews. And of course, if you apply the same tool over a systematic review, had you been having the systematic review with you and not the overview or the umbrella review, then you would be doing the same things for that. And you must have found most of there, because umbrella review is looking at the systematic reviews. So and rightly, I would say that most of the time you did it rightly, finding out those things in that umbrella review. Very well done. Thank you.
Thank you.
All right, thank you very much.
I thought you had closed.
Prof, I think we can wrap
Of
now.
course.
That's okay
It
by
shows
you.
that you are, enjoying the
Is
double.
somebody saying something?
See yourselves good. Just 2 seconds.
I think Cynthia was saying something. Yes, Cynthia.
Go ahead.
Sorry about that.
Okay. So yes, Fortune, please continue.
Oh, okay. I was asking Prof, would you want another presentation? Maybe we can stretch to 4:30, or we can wrap.
If another group is ready with a quick presentation, we can have it, or otherwise then they can share it later.
Okay. Okay, so we can take one more. Please try and keep it within 2 or 3 minutes. So we have to wrap before 4:30. Apologies for keeping us this long. Go ahead, please, Chigwezo. You can share your screen as well.
Yeah, I just want to make a complaint. Our group did not actually do anything. We were confused all throughout the section. So it's just now that the presentations have been made that some of us are getting to know what we're expected to do. So I know I just peeped when we were actually brought back to this room, when Prof was actually giving an overview of what they are supposed to do. Nobody told us, we were not actually incited on how to go about it. So all my group members, so many left the group before the breakout session ended. And it's not an easy thing to do. Some of us don't have an idea of some of these issues. And I believe, and I want to suggest, before the end of the first section, which is a general section, I think it is important that an example or maybe a demonstration should be made for those who doesn't know what to do in on how to actually go about the practical sections to get an insight by doing a demonstration of what is expected of us. So that when we go into the breakout section, we can actually get done with these issues. So I know today is the first day, and I believe subsequently things will get better. Thank you.
All right, thank you very much, everybody. Well, first, I'd like to clarify that we sent the group instructions across very early this morning. And it's not very correct to say that the groups were not told what to do, because the instructions were very clear, and we believe that everybody had received that email. So the only thing that we didn't do, we didn't grant access to the forms, to the document, and that's because this activity was supposed to be done as a group and not individual. So we waited up till the time for the group activity to grant access to the document. And that is the article you're supposed to review and the answer guide. But regardless, we're very happy with your suggestion and contribution. And we'll discuss with our team, and we can see how other practical activities can be, more fruitful and eventful. But then we would like to encourage us to recheck our mails, because we try as much as possible to send the instruction across way before the time. And if you are not clear with any of the guidelines, you could let us know in the email or in a WhatsApp group, and we can respond to that. Because it's difficult to, give instructions to every single person on the call or every group on the call. It's easier if everybody has this instruction way before that time. So thank you very much. Please, will there be any other question? I see Joel and is up. Can go ahead, please.
Thank you. I've just put my question, no, my suggestion in the chat box that instructions and material should be given probably a day before, not on the day, because some of us may be working too close to the time of the commencement of the program, so that we won't have enough time to look at it and have time to read through. Like in my group, somebody said that she came right from work to the session and she did not even have opportunity of opening the mail. So that is my own suggestion. Thank you.
All right, thank you very much, Joel. Your suggestion is understood and well taken note of. All right, that will be a wrap for today. Thank you very much, Prof. You have final words, Prof, before we give final announcements.
Yeah, thank you very much. No, I just want to say that this has been a very good group. And of course, this is the day one. And most of the time when you have such online kind of courses, the first day is always like you are warming up. So just take it as a warm up and look at your emails, look at the articles that you have received, and try to reflect on the presentation and what we have already discussed. Just read the articles first and try to see how much system, and you can browse the net, you can download some systematic reviews in your areas and just go through them and see what they have written. Are those things according to what we have learned in the class? So once that you understand that, then you will get the interest in yourself. You will get the interest. You will have the interest in looking at the AMSTER guidelines and try to look at the criteria and judge those systematic reviews on your own. And you see what they have done good and what they couldn't do and what they should have been done. Actually, this exercise then gives you a good opportunity to apply your knowledge in understanding the systematic reviews and looking at the critically. That gives you an opportunity to make yourself understand better. And when you are going to do the systematic review as a team, then you will not commit the same mistakes or you will follow the golden principles or gold method of, because there are systematic review which have been done in a very accurate way. So that will be the kind of your way forward. And there will be some which have been published, but they have the errors in them or problems with them, and you can also look at them and reflect on them. Thank you.
Thank you very much, Prof. Thank you very much, everybody. We really apologize for all the challenges that you're experiencing today. And we're very happy with your feedback, and we're doing everything possible to see how we can work on them accordingly. As a follow-up to the group activity, like I mentioned, you're free to work on it as a group some other time. And as soon as we are done, we have access to the Google Doc. We'll share with Prof, he'll review, and he'll send his feedback across. We'll also be sharing the formative assignments for this session almost immediately after this call. The formative assignment is to be completed individually, and it is meant to be peer reviewed, meaning that once you do the assignment, you are to send it across to your peer reviewer. We have connected you already to the peer reviewer. You have the name and the email, so you can connect with each other. And the person will be the one to grade the assessments and also make the submission on your behalf. And the deadline for making this submission is Monday, 11:59 West African time. So hoping that the group activity, like you have suggested, for the next week's session will come up much earlier, maybe 3 days to the day we'll be having the activity. All right, could you please let me know if there's any other thing concerning this workshop you need clarification on? But we can assure you that the recording and the slides will be sent to your email as well.
Am I audible?
Yes.
Hello. Okay.
Yeah, we can hear you.
Okay. Thank you for this presentation today. Thank you, Prof. I just want to say that, I mean, for myself, maybe there are some other colleagues here who are management oriented. Okay. I just want to plead that some of these assignments or some of these examples, some of these tools given shouldn't be tilted towards the sciences or health sciences or, natural sciences, whatever. There should be a balance. That's just my plea, so that those of us in management are also not at any loss.
All right, thank you very much, Michael, for that very important suggestion. So we've also put this down, and we're sharing it across to the coming facilitators. So we have 4 more modules coming up. We'll try to see how we can balance the examples and the case studies that will be used. Thank you very much.
I'm sorry, right, when is the next class? Hello?
Go ahead.
Oh, sorry, when is the next class? And is this a weekly thing? Is it every Wednesday?
Yeah, we have shared the schedule with us already. And yes, the live session is every Wednesday, 2 to 3 p.m. West African time, and the group activity starts immediately 3 to 4 p.m. West African time. But within or between the live session and the group activity, we'll have to do our formative assignments and send it for peer review, get peer review feedback, and pass those feedback. And we've also mentioned that you're free to meet with group members in case you're not done with the group activity. You're free to meet any other day in the week to complete it. And as soon as you're done with it, we'll share with Prof and he'll share his feedback.
Okay, thank you.
All right, thank you very much, everybody. Really apologize for every inconveniences, and we take your suggestions very serious. We're looking forward to improving on all aspects of what you've suggested. and make the coming sessions better. Thank you very much and see you in the next session.
Thank you.
Thank you.